Good evening, everyone. My name is Mateo. I work at the Minnesota Department of Health, yeah, I'm here today mainly just to help share some information about the vaccines, answer any questions. I'm not here to to convince anyone or anything like that. Just here to share some information and help answer any questions that may come up. So I'll go through a quick presentation, and then I'm more excited to listen to any questions that come from you all. Next slide. So here's kind of what I'm going to be covering today. So going over, broadly speaking, some concerns that we often hear and some questions, a little 101 as to how vaccines work and how they're made, and then the steps that it took to create this COVID-19 vaccine, some tips as to how to find the vaccine, and then what you can expect from getting vaccinated. Next slide. I do want to recognize the land that we stand on, recognize and acknowledge the Dakota, the Ojibwe, the Ho-Chunk, and other nations of people that call this place home. People come here of their own volition, against their will, and people have lived on this land for a long, long time, for far more generations than we can ever count. So I just want to acknowledge that. Next slide, please. I think it's also important to recognize the trauma, medical abuse, and discrimination that's happened specifically to Black, Indigenous, and people of color, those with disabilities and LGBTQIA communities, that has led to a lot of distrust in medicine and public health. And we at the Department of Health, our local public health, medical providers, and all of our partners working recognize and acknowledge that, and we're actively working to rebuild trust with communities and bring those community members and their voices to our tables. Next slide, please. So kind of where do we go from this? The first step is obviously recognizing and acknowledging that trauma. And some of the things that we're trying to do better is be more transparent and open about the processes that how we do things and how we make decisions, seeking community input, building trust, and ultimately sharing power. Next slide, please. So a little bit of Vaccine 101. Next slide, please. So, vaccines are really prevention from sickness. So they help keep us from getting sick and getting diseases like the flu and the chickenpox and now even COVID-19. And when we vaccinate a community, it really helps to prevent diseases from spreading. And it really helps to keep us and our communities safe and healthy. A term that we probably hear a lot about is this term called herd immunity, or how I like to say it, community immunity. But essentially, it's when we reach a certain proportion of the population that's been vaccinated and is protected against specific diseases. And what that does is that actually helps protect all the other people who can't get vaccinated or who don't get vaccinated, right? So that's how we all protect ourselves together. Next slide, please. So a vaccine is just a product that's designed to help prevent diseases. And there are many different ways that vaccines have been produced and can be produced. So one of them is using like a whole germ, and actually have my friend here, Mr. Coronavirus, to help explain how vaccines work. So we can use a whole germ where we take the entire virus and we either weaken it or we kill it so that it can't make someone sick anymore. But we show our bodies and our defense systems this virus so that it can learn how to attack it and how to develop antibodies, or kind of our body's defenses and immune system against that. Another way that we create vaccines is just by taking a part of the germ. So we might like cut it up or just take certain parts of it and introduce that into our bodies. Again, the same reaction, right? What we're trying to do is kind of show our bodies, this is what the bad guy looks like. How do you defend and build defenses against that, so that when the virus comes naturally, or where we naturally get infected in the future, we already have that immune system. And then another way that we develop vaccines is using no germs. And that just means that we're just using instructions that teach our body how to recognize and protect against those viruses. And that is the vaccine. That's how the COVID-19 vaccine works. And I'll talk a little bit more about that later. But I think it's important that we all recognize that a vaccine can't make us sick with the disease that it's trying to prevent. What it can do, and what it often does, is it gives us a bit of side effects from the vaccine, and that's perfectly normal and natural, and I'll cover that a little bit later as well. But just want to make sure we all know that the vaccine can't actually make us sick with COVID, or if it's the flu vaccine, it's not giving us flu either. Next slide. So how does the COVID-19 vaccine? So this is called a coronavirus for a specific reason, right? It has these little like peaks on its shell, on its outer shell. These peaks, these like proteins. And in Spanish, the word for crown, because it looks like a crown, is a corona. So that's why it's called a coronavirus, because it looks like it has a little crown on it. Now, these proteins, these spikes on the shell, is actually what makes this virus, attach so well to certain receptors in our body. But it's also one of the key signifiers that help our bodies identify that viruses. So what this vaccine does, both the Pfizer and the Moderna, which are no-germ vaccines, right, is they have these instructions that we call messenger RNA, or like mRNA. And what they do is they deliver these instructions to our bodies, and our bodies recognize and read those instructions and then start producing these little proteins so that our body can learn to attack and defend those proteins. And then what that does is we develop antibodies against those proteins. So in the future, a few months down the road, if we get infected with COVID naturally, we already have those antibodies and those defenses that can identify and target those proteins, and therefore prevent us from actually developing the disease of COVID and getting sick. So that's the Pfizer and Moderna vaccine specifically. The Johnson & Johnson vaccine is also a no-germ vaccine, and it works in a slightly different way, but with the same outcome. So the Johnson & Johnson vaccine is a one-dose vaccine, and Pfizer and Moderna are two-dose vaccines. It also doesn't create the virus and it can't give us COVID-19. What it does use is it uses a very weakened common cold virus, and it holds those instructions for our body to recognize and fight it. So whereas one, they're delivering just the instructions, in the Johnson & Johnson, we put those instructions inside of a weakened virus that cannot replicate, it cannot operate how it normally would, and then it's still with the same effect of teaching our body how to develop those antibodies and how to recognize that virus, so that if it comes in the future, we have a good defense system against it. Next slide, please. So what are the ingredients that are in this vaccine? It doesn't contain eggs or pork products or gelatin or latex or preservatives. It doesn't have a microchip either. All it has is kind of these fats that help protect the genetic material and make sure it's stable. They have sugars to prevent the solution and the fats from kind of all bunching up. And it has some buffers, and buffers really just help keep the kind of the solution in the vaccine stable. So that's all it has. It has fats, instructions, sugars, and some buffers. Next slide, please. So I want to briefly go over, next slide, please, the steps to develop not only this vaccine, but also all of our vaccines to make sure that they're safe and effective and that they actually work. Next slide, please. So before that, I do quickly want to go over kind of the clinical trials, and this is a lot of data, I'm sorry, but this is mainly just to show that a lot of people were part of these clinical studies and these clinical trials for this vaccine. For Pfizer, over 40,000 people. For Moderna, over 30,000 people. And for Johnson & Johnson, the Johnson & Johnson was a global vaccine trial, but in the US, it had over just under 20,000 participants, and mainly showing that it was the representation of these clinical trials was very diverse, of a lot of different race ethnicities, as well as a lot of different age groups. and a lot of people with underlying health conditions as well. So, this gives us a really good understanding of who was in it, and it helps us kind of make sure that this is safe and effective for all the folks that we're recommending this vaccine for. So this is kind of the timetable of how vaccines are developed in the United States. So, first of all, as we can probably all expect, is it takes a long time to develop a vaccine, right? Usually, I mean, just the body of literature and knowledge and scientific research that needs to happen when we first discover a virus or a germ, usually takes a long time. And a question that I get often is, it can take many, many, many years, if not decades, to develop enough research and knowledge to know how to develop a safe and effective vaccine. COVID, the virus that causes COVID is only like just over a year old. How did we develop a vaccine this quickly? And what helps to know is that COVID-19, the virus that causes COVID-19 might be new to us, but the family of coronaviruses as a virus family is not new. And we've actually, been doing research and been doing, studies and trials and starting to work on vaccines for a very, very, very long time related to coronaviruses. So when this virus came about, we already had a lot of research. We already had a lot of scientific body and new and emerging technologies that were proven to be a really, really good model and a really, really good starting point to develop a safe and effective vaccine against this virus. So once we have all that research and we kind of have a good strategy and a few contenders of a vaccine, we start these clinical trials. And so, usually we start a phase 1 and then we start a phase 2 and then we start a phase 3. And there's a bit of an echo, but and then what happens is the phases get larger and larger and larger, right? So the phase 1 might only have like 10 people in it, and phase 2 might have a couple hundred, and phase 3 might have a couple thousand or a couple tens of thousands, right? And usually these are staggered out with long waiting times in between to assess data, to make sure that we can move to phase 2. And the reason that these are staggered, first and foremost, is mainly because of money, right? These phases and the development of vaccine costs a lot of money. So it's not really in the interest of folks who are making these vaccines to move on to future phases if they don't know that, if it hasn't cleared the previous phase. And what happened this time around was the government put kind of all of the money behind this, and a lot of companies and a lot of different industries and organizations were working together collaboratively to develop said vaccines. So with those things in mind, we were able to do phase 1 almost concurrently as phase 2 and almost concurrently as phase 3 to really expedite this process. And once we have all that data, we submit that to the FDA. And the FDA is kind of the regulatory agency at the national level that looks over all of this data related to food and drugs. So they look at that data and they say, yep, this is safe and effective. Kind of give it a seal of approval. And there's many different types of approval. And this one was given an emergency use authorization. And then once the FDA gives it that approval, then it goes to ACIP. And ACIP is the federal kind of regulatory body that looks at vaccines and gives kind of recommendations as to who we should give this vaccine to, who we shouldn't. Are there any kind of contraindications or any reasons why we wouldn't give someone the vaccine, and things like that. And once that has been kind of given, then the vaccine is rolled out, and then the CDC and the FDA both continue to look at data. So a lot of the times we kind of follow up with people who've been vaccinated to make sure that it's working well, there's no like unintended side effects or anything like that. So this is kind of what happens not only for a regular vaccine, but also the COVID-19 vaccine. So it's a very, very robust process to ensure that the vaccine's working how it's supposed to, that it's safe, and it's actually doing what it's trying to do, right? Which is preventing disease. So what we know about the vaccine right now. So we know that it helps many people not get sick, and some get less sick from COVID-19. In study participants, the vaccines prevented sickness, clinical symptoms most of the time. For Pfizer and Moderna, it's around 95%, and for Johnson & Johnson, it's around 67%. Although all three vaccines protect the same against death and against severe hospitalization. And those are really the big outcomes that we wanna prevent. It works in all different ages, in different racial and ethnic groups, and in people with underlying health conditions. And preliminary data does show that the vaccine works with some of the new COVID-19 variants, although we're still trying to assess, to what extent its efficacy is in all the various variants that we're seeing emerging these days. So for the Pfizer and Moderna, which are 2-dose series, it requires 2 doses, 3 or 4 weeks apart from each other. And for the Johnson & Johnson, which is a 1-dose, it's one and done. But we do have to wait 2 full weeks after receiving the final dose before having full protection for COVID. So that's 2 full weeks after the 1 dose of Pfizer, of Johnson & Johnson, and 2 full weeks after the 2nd dose of Pfizer and Moderna. So we're still learning a lot about the vaccine and how we are going to function as a society moving forward. So the first thing that we still need to figure out is this metric for herd immunity, right? So we know that, for example, for the flu, estimates of herd immunity are anywhere from like 75 to 85%. And what that means is that if 70 to 85% of us are vaccinated, then we are all protecting all the others, right? That extra percentage of people who weren't able to get vaccinated. For a virus like measles, that's actually really high. So 95% of the entire population has to be vaccinated against measles to protect the rest of the 5%, and also so that there's no kind of outbreaks that emerge. And we don't know what that percentage is for COVID yet. We have some preliminary goals of shooting for anywhere from 70 to 85%, but the exact number is still something that we don't yet know. The other thing that we keep learning about is how vaccines will affect the spread and the transmissibility of COVID-19 for those who have been vaccinated. So we know it protects us against illness and sickness and hospitalization and death. How well does it protect me from spreading it to others if I am in that extra 5% or something like that? So that's why it's really important to remember that the vaccine is a really good tool for us, right? It's going to help protect us. It's going to help protect our communities, but it's a tool. It's one of many tools that we can use to help kind of slow the spread and kind of end this pandemic. And the other tools, as we all know them so well, are to wear a mask, make sure that we're 6 feet away from other people, washing our hands, and staying home if we have any symptoms related to COVID. And the last kind of question that we're still learning about is how long the vaccine protection is going to last. And I can touch on this a little bit later as well. So how to find a COVID vaccine, the $1 million question. I'll start off by recognizing that we haven't made it easy. There's so many resources out there. There's so many communications. There's so many messages out there. There's so many different websites out there. So I'll try to give you some tips and tricks to navigate the system. So I do want to kind of acknowledge that, unfortunately, there just isn't enough vaccine for everybody at the same time right now. So some of the key questions that we were asking ourselves when, especially in the early days of rolling out of vaccines, was who's most likely to be exposed of COVID, who's most likely to get sick, who's most likely to die, unfortunately, of COVID, and how can we distribute a vaccine equitably? So, some kind of key tips and tricks to navigate the systems. So we have a vaccine connector, which can be a useful tool for a lot of folks. And that's kind of like, oh yeah, the links are there, perfect, in the chat. I think of the connector as a passive way to hear about a vaccine opportunity. And what I mean by a passive way is you just kind of put your information in there. Unfortunately, we do ask a lot of questions in there, and I'm sorry about that. But you know, you answer all the questions in there. They really kind of help us connect folks to when it's their time and where they can go. But you put your information there once and done, and you're good to go. And then you might get an email, you might get a text, you might get a call that says, hey, you know, there's this opportunity to get vaccinated. But that's what I mean by passive, right? You put your information there and you're good to go. And then you can look at, you know, there are more active ways to find vaccines. There is a website called Vaccine Finder. There's another one called vaccinespotter.org. Those are really, really good tools, and they're specific for the state of Minnesota as well, to kind of help find where there are vaccines in various pharmacies and various like health clinics. So those are also some really, really good tools. Other places to look at for vaccination, you know, so, you know, as you've probably heard, there's kind of vaccines at various different like pharmacies. So calling a pharmacy near you and saying, hey, do you have vaccines? You know, I'm eligible, and I'll talk about eligibility in a second. I'm eligible, you know, do you have vaccines? And then they can connect you with like registration or scheduling an appointment, going to your clinics as well, especially for folks who have underlying health conditions, calling their healthcare providers, or if they don't have a specific healthcare provider, calling a clinic near you or a clinic that you feel comfortable going to is another great kind of way to get vaccinated. And the final way is to connect with your local public health agencies, to connect with your city administration officials, to connect with folks like Brenda and others on this call that can help you know, connect you to some of those resources. So let's go to the next slide to kind of see what I was going to talk about. So originally, this is kind of where we were at the state, right? We were vaccinating healthcare workers, long-term care residents, educators in childcare, people over 65, and then we moved into kind of this much larger category of, you know, essential workers, people over 50, people with underlying health conditions. But today, we just got an announcement that starting March 30th, which I think is on Tuesday, everyone over the age of 16 will be eligible to get a vaccine, which is really, really good news, right? Opening up eligibility is important, but I think it's important for us to recognize and remember that although everyone's eligible, we still don't have enough vaccines for everyone, right? So it's still going to be a little bit of a waiting game, and I think it's still going to be important for us to kind of respect that there are some folks that are a bit more vulnerable, that need to get vaccinated much sooner than some of the rest of us. I'm not here to say who should go first or who should get second, but I think you know, if we know some community members that are a little bit older or might have some, you know, underlying health conditions or who have to go to work every day or have a large family, I think, you know, we should really try to help them get connected to vaccine opportunities. Yeah, so that's exciting news. We have been hearing, unfortunately, of some COVID-19 vaccine-related scams, unfortunately. You know, one thing we just want to say is, you know, if the Department of Health is calling you, you know, we're never going to ask for immigration status. We're never going to ask for any financial information. We're never going to ask for any kind of social security number or any kind of like sensitive information like that. The only questions that we are required, the only kind of data points that we're required to collect for vaccine purposes are someone's name, their date of birth, their gender, their address, and their phone number. So those are kind of the only points of data that we are ever gonna require or really ask for. You know, the connector, it asks a few more questions, especially related to like medical conditions and work and occupation, because especially early on in the eligibility criteria, those were kind of questions. But, you know, like I said, we really don't ask any financial information or immigration status or things like that. And the other thing I'll say is any offers to sell or ship vaccines are also scams. That's just not what we're doing. The other thing I'll say is if you ever ask yourself like how can I know that this is Department of Health? If you're talking to us and you ask us to like prove it, we do have kind of like a way that we can prove it. We'll give you like our phone number. You can like look up that that's our real phone number. You can call us. So there's ways to prove you're talking to us. So the process for getting vaccinated. Vaccines will be free. So first and foremost, if anybody's asking for money, don't pay them because the vaccine will be free. The vaccine is recommended for all adults, even if someone has already had COVID-19. The Pfizer vaccine is approved for all those 16 and above, and the Moderna and the Johnson & Johnson are recommended for those age 18 and older. The 2-dose series requires 2 doses, and the 1 dose requires 1 dose. And I think it's important to recognize that it's okay to take our time to decide about getting vaccinated. Some people are really excited to get vaccinated and they want to be the first ones in line. And some people need a bit more time. They want to kind of look around and they want to, they want to see what happens. But it's important to recognize and validate that people have different feelings about the vaccines, and just be ready to answer any questions and help educate or inform as much as we can. So a bit of the side effects that we often hear about this vaccine. So obviously, at the point of injection where we get that shot, it's typical to have a sore arm, to have some muscle aches, to feel like fatigue and tired. Headaches are also pretty common. A fever is far less common. But what all of these symptoms mean is really that the vaccine is working, right? And it means that because our bodies are really strong, but they're also very sensitive. So when we're exposed to something that isn't usually found in our body's natural reaction is to work really hard to create those defenses and to attack, the pathogen or the virus that isn't usually there. And that's a lot of energy. That's exhausting for our body. So it's normal to kind of feel that way. It's also normal if you don't have symptoms. Just kind of some people have them and some people don't. The symptoms these side effects usually start within 24 to 36 hours after getting vaccine, and they usually go after like 2 days of when they first arrive. The other thing that can happen is kind of some more serious like adverse events or even like severe allergic reactions, but those are very, very, very rare. They documented cases is only like 2 to 11 for every like 1 million doses given. So they're very, very rare. And they usually happen within the first kind of 15 minutes after someone's been vaccinated. And that's why we always ask people to stay and stick around for around 20 minutes after they've been vaccinated to make sure we're monitoring them and that they're feeling all right. So we have Pfizer, Moderna, and Johnson & Johnson currently in the state of Minnesota and the country. Other vaccines are in production, and we are really expecting that it'll be like widespread and like anybody can get a vaccine at any time by this summer. So I just want to kind of wrap up, and then I'm really excited to see if there's any questions. But the vaccine is safe. It's effective. It helps to prevent us from getting sick from the virus and from COVID-19. Unfortunately, there's a limited supply right now, but getting the vaccine will be free for everyone. And I just want to recognize that some people want to get it and some people don't. And to remind us all that if those who want to and can get it, we get it, we're also helping protect all those who can't right now. Yeah, thank you so much.